द बेसल हु रिमूव ब्लॉकेज, यिन अवरोध निवारक, इसका नाम है यिन अवरोध निवारक। द अदर नेम ऑफ चोंग मो चैनल और द चोंग चैनल, इट इज कॉल्ड सी ऑफ ब्लड, खून का समुद्र, द सी ऑफ ब्लड। इस नाम से क्या पता चलता है? दैट इफ वी वांट टू इंप्रूव द ब्लड, if we want to increase the blood, we can work on the Chong because it is the sea of blood. Very important name. The other name is also thorough way. Thorough way. Penetrating channel. The sea of all 12 meridian. So all the 12 meridian, whether the yin meridian or the yang meridian, the 6 are the yin meridian, 6 are the yang meridian. So sea of all the 12 regular meridian and the sea of arteries and veins. हमारे शरीर की जितनी भी आर्टरीज हैं और वेन्स हैं उनका भी समुद्र है, मेरिडियन का भी समुद्र है, ब्लड का भी समुद्र है। इट इज द सी ऑफ ब्लड, सी ऑफ मेरिडियन, because it's the sea of blood, so we can understand okay sea of artery and veins कि ब्लड का समुद्र है, तो चलो आर्टरी और वेन्स का भी समुद्र है क्योंकि आर्टरी और वेन में ही तो ब्लड बहता है। So these are name of Chong. If you see the diagram given here, then we can see the stomach 30 point here. Then how it is following the kidney meridian. So the Chongmo is following the kidney meridian. Then how it's going upward, kidney 12, 13, 14, 15, 16, 17, 18, 19, 20, 21 and all. It means the kidney meridian is very deeply connected with the Chongmo. We can further see, if you see, just see this root. We will be discussing about this. अगर अभी आप सिर्फ इस रूट को देखें roughly. So Chongmo is in the abdomen. Then it's going in the chest. So it's also crossing the heart. It's passing the throat region. Then we can see how it's going on the face. ये हमारे कैसे face को भी जा रहा है. So you can see this channels, this root, the how this is supplying this entire part. In the future, in the upcoming discussion, we will discuss that how the Chongmo is working on the abdominal problems, on the chest problem, on the heart problem, on the throat problem, on the facial problem. There are many other problems what we can see in this root. Now in the second image you can see, अब दूसरी image में हम क्या देख सकते हैं? The Chongmo channels also going in the legs. ये हमारे पैरों में जा रहा है. Okay. On the inner side of the leg. Then it's going in the feet, under the feet and above the feet. हमारे feet के ऊपर नीचे जाता है. We will see that. So it's supplying entire feet and reaching on the REN1. हम REN1 जानते हैं कहाँ होता है. REN1 यानी मूलाधार चक्र, REN1 यानी पेरिनियम का पॉइंट, CB1 we know the location of CB1. Or we can understand here from the CB1, one branch going in the leg. From the CB1, we can see how it's going to the genital part. From the CB1, we can see how it's going along the spine. तो सिर्फ इस इमेज को देखिए और कुछ समझने की कोशिश करिए, अभी क्या होगा कैसे होगा, विल अंडरस्टैंड. So it's going in the leg, it's going in the genital part, it's going along the spine. तो इसके बहुत सारे अलग अलग डिफरेंट डिफरेंट पाथ हैं. जैसे एक नदी है, एक ओरिजिन है, और वहां से एक कैनाल राइट गई, एक लेफ्ट गई, एक ऊपर गई, एक नीचे गई. So there are many canals going here and there. In the same way, somewhere from the CV1, one is going in the leg, one is going in front of the spine, one is going in the abdomen, one is going in the uterus in the female. There are many branches of the Chong going here and there. That's why Chong is very good for uterine problem. Chong is very good for spine. Chong is very good for digestive problem. Chong is very good for heart problem. Chong is very good for leg problem. पैरों के दर्द के लिए, इन सब के लिए चोंगमो का एक महत्वपूर्ण योगदान है. There are mainly 5 branches of the चोंगमो. हमारी चोंगमो की 5 ब्रांचेस हो सकती हैं. 5 branches. Okay. So let's discuss these all the 5 branches. एक तो ब्रांच एकदम से क्लियर है. चलिए यहां से देखते हैं 5 branches of the चोंगमो. We can consider that it's starting from the point nearby CV1 और the REN1 के आसपास से हम मानते हैं कि ये प्रारंभ हुआ. So we can see the 4th branch going in the leg near the medial malleolus. हमारे medial malleolus के पास जा रही है. That is the 4th branch. Okay. और पैरों के नीचे जा रही है, medial malleolus. So we can understand the 4th branch means who is going in the leg. That is the 4th branch. Okay. The 5th branch going on the feet. ये feet में जा रही है. तो 4th branch in the leg, 5th branch on the feet. It's very clearly mentioned. It's going above the feet and under the feet. यानी हमारे पैरों के ऊपर और पैरों के नीचे, है ना, पैर के ऊपर भी पैर के नीचे. तो 2 ब्रांच तो यही हो गई. There are 2 branches here only. One branch is going in the stomach 42. Stomach 42 is above, and one branch is going below the great toe, down to the great toe. अब हम 3 ब्रांचेस की बात करते हैं. Right? So one branch is, we can see in this image. Look at the image here, this image and this image. The one branch, if you look at here, I will highlight this, only and only for lower abdomen and the genital. We can see this. Only and only for lower abdomen and genitals. So one branch is going in the leg, one branch is going on the feet, one branch only and only for genital part. Only and only for genital part. So supplying the lower abdomen, supplying the genital parts, uterus in the female and male genital part in the male. तो तीसरी एक ब्रांच हमारी सिर्फ यही होगी, only the genital part. One branch is going in the upward direction till the chest, and one branch from the throat region going on the face. So how many branches? I will repeat once again. There are 5 branches. From the point nearby the CV1, one branch going in the leg near the medial malleolus, one branch going on the foot, one branch going in the genital part, one branch going upward till the chest cavity, and one branch going in the face area. How many branches? 5 branches. So we can consider the branch who is going to the genital part, branch number 1. Branch going upward, this is the branch number 2. Branch going on the face, branch number 3. Branch going in the leg, branch number 4. And branch going in the feet, that is the branch number 5. So there are total 5 branches coming out from Chong. Okay. So let's see the first branch. चलिए पहली branch कौन सी है? Quickly I will ask you. Then I will discuss this. Which is the first branch? Where it is going? In the which part? Volume is low. Volume is okay. Volume ठीक है अभी? Volume is okay. पहली ब्रांच कहाँ जाती है बताइए? लोअर जेनिटेलिया. जेनिटेलिया तो लोअर एब्डोमेन में ही है ना भाई. लोअर एब्डोमेन बोल दो, जेनिटेलिया बोल दो, एक ही बात है. लोअर एब्डोमेन एंड द जेनिटल पार्ट. Like suppose you want to treat the lower part of the large intestine, that is also lower abdomen, or you want to treat the genital part or the uterus in the female, these all are, we can consider as a first branch. Actually, this is just for understanding purpose. Like from your home, you are going to a clinic. Then first you are going straight, then you're taking a right turn, then you're again going straight, then you're taking left turn. So we are dividing, okay, branch 1, branch 2, branch 3. But if you see, entire is a one route only. एक ही रास्ता है आपके घर से आपके ऑफिस तक का, एक ही रास्ता है. बस आप समझने की दृष्टि से उसे पार्ट बाय पार्ट डिवाइड करो. Okay, this is the road 1, road 2, and road 3. In the same way, we are dividing the 5 branches. Ultimately, all are one only. Okay, where is the second branch going? Second branch कहाँ जाती है? Second branch going in the abdomen, supplying the abdominal area, like the stomach area, kidney, heart, going in the chest region. The second branch supplying your heart, your lungs, your abdomen, your kidney and all, right? Where is the third branch? Third branch कहाँ जाती है? The third branch is going upward, supplying the throat region, face region, lips area, cheeks area, and ending on the eye, आंखों के पास. The person suffering with the problem of the lips, problem of the face, problem of the throat, problem below of the eyes, we can think about this Chong. Now here the fourth branch. So fourth branch is going in the leg near the medial malleolus. Okay. Where is the fifth branch? Above and below the feet. Perfect. Wonderful. Now let's see a few things here. If we talk about the internal path of the Chong, the first branch, second branch, third branch, fourth branch, and the fifth branch. Let's talk about the first branch, this one. So it's begin in the lower abdomen and going to genitalia and working on the fertility. ये जेनिटल पार्ट को जाती है और फर्टिलिटी को कंट्रोल करती है. So now if the patient is coming with the problem of infertility, problem of the uterus, problem of the menstrual disease, some menstrual abnormalities, irregular menstruation, early menstruation, delay menstruation, no menstruation, uterine fibroid, endometriosis, erectile dysfunction in the male, or any type of the problem which is having connection with the genital part, which is also called lower dantian. Lower dantian means this: lower dantian, middle dantian, upper dantian. यानी जैसे ट्रिपल वार्मर होता है ना, अपर वार्मर, मिडिल वार्मर, लोअर वार्मर, तो हम लोअर वार्मर की बात कर रहे हैं, लोअर डेंटियन की बात कर रहे हैं. तो दिस इज द फर्स्ट ब्रांच. नाउ लेट्स टॉक अबाउट द सेकंड ब्रांच. चलिए हम सेकंड ब्रांच की बात करते हैं. So second branch is going upward from the stomach 30 because stomach 30 point here. Then supplying the stomach area, supplying the kidney, supplying all the abdominal organ and the chest organ, lungs and heart and all. This branch is going in front of spinal cord. ये हमारे स्पाइनल कॉर्ड के फ्रंट से जाती है. We can see here how this branch is going. So this branch is flow through the stomach 30. Then we can see it supply all the part coming in the abdomen and the chest. That is the second branch. Not regarding the third branch. Third branch means on the face. So let's talk about the third branch. From the chest, it's going to the throat region. Then it's going to the lips and terminate below the eyes. Throat, lips, and terminate below the eyes. So now I want to read the throat problem. We want to read the lips, we want to read the eye problem. We can think about the Chong. Chong. Then fourth branch going in the leg. So it descends from in the legs, going toward the medial malleolus. And from there, two yin are taking origin, means yin linking vessel taking origin, yin heel vessel taking origin from this only. It create yin, यानी हमारे जो दो ईओबी के चैनल इससे निकलते हैं, इससे बनते हैं, यहां से क्रिएट होते हैं. इट्स क्रिएट yin linking vessel and the yin heel vessel. So this branch is supplying the leg. Now let's talk about the fifth branch who supply the food region. अब हम fifth branch की बात करते हैं जो हमारे food को supply करती है. So fifth branch is supplying the food area. Flow on the stomach 42. Stomach 42 is above the feet. ये हमारे पैरों के ऊपर होता है. And down to the big toe और big toe के नीचे. So it's going below the feet, above the feet. So we can see here one branch going above the feet, one branch going below the feet. So the supplying the foot area from here, yang is taking origin, means yang linking vessel and yang heel vessel. So creates yang linking vessel and the yang heel vessel. तो इसकी 5 ब्रांचेस को हमने समझा. यही चोंगमो का सार है. तो अगर ये समझ में आ जाए तो हम समझ सकते हैं the how the Chongmo play very important role. Because in the Chongmo, in the root of the Chongmo, अगर हम Chongmo के रास्ते को देखें, so we have to focus on few things. हमें कुछ चीजों पर focus करना होगा. The very important points in the root of the Chongmo. So again, you have to see this image. आपको फिर से इमेज देखना है. If you look at this image, then we will see RAN 1. हम RAN 1 को देख सकते हैं. और RAN 1 कहाँ होता है? Where is the CB1? I will show you the location. Then after the RAN 1, this is the RAN 1, then we can see stomach 30. Then many points of the kidney meridian. बहुत सारे point kidney meridian. But in between them, you can see there is one point also the RAN 7. RAN 7. For the RAN meridian, RAN 1 and RAN 7. RAN 1 and this is the RAN 7. RAN 7 is just below the navel region. तो नाभि के नीचे RAN 7 होता है. And we can see the stomach 30. And the other than kidney 12, 13, 14, 15, 16, 17, 18, 19, 21, and even till the 26. There are too many points, especially kidney 11 to kidney 21, especially. कि चोंगमो हमारी कहां से पास होती है? हमारी चोंगमो RAN 1 से पास होती है, RAN 7 से पास होती है, किडनी स्टमक 30 से पास होती है और किडनी 11 से लेके किडनी 21 से पास होती है. So Chongmo is crossing RAN 1, RAN 7, stomach 30, then kidney 11 to kidney 21. And here the main connection of the Chongmo is with the parasympathetic nerve. हमारे शरीर में जो पैरासिम्पथेटिक नर्वस सिस्टम होता है उससे यह कनेक्टेड होती है. That's why we know when parasympathetic nervous system is activated, we are relaxed, our digestion is good, our liver working nicely, gallbladder working nicely, pancreas is doing good secretion, kidney, adrenal gland, small intestine, large intestine, all organ doing very good work. So Chongmo is directly connected with the parasympathetic nervous system. It's activating our parasympathetic nervous system. ये हमारे पैरासिम्पैथेटिक नर्वस सिस्टम को एक्टिवेट करती है. तो अगर किसी को या so it having connection with the vagus nerve, you are right. Yes. So suppose someone is always in the hurry, curry, worry, because of that having disturbed digestion, we can use Chongmu. If the person is always in the hurry, curry, worry, suffering with the diabetes because of the pancreas, we can use Chongmu. Because of the hurry, curry, worry, person having urgency of the urine because in the हम कोई डरता है ना तो उसका यूरिन भी पास हो जाता है कई बार. डर के मारे पेशाब निकल जाता है, मल भी निकल जाता है. So there is a stool is passing, urine is passing, urgency of the urine due to the anxiety, due to the stress, due to the fear factor. So we can calm down the sympathetic nervous system and we can activate the parasympathetic. Why? This Chongmo के द्वारा. Person is very angry, and we know the anger is the emotion having connection with the liver. We can calm down the liver by activation of the parasympathetic. So work on the Chongmo. Gallbladder work on the Chongmo. Stomach work on the Chongmo. Spleen work on the Chongmo. Stomach, spleen, pancreas, liver, gallbladder, ureter, small intestine, large intestine, or all organ. Chongmo is the vessel who activate parasympathetic nervous system. And the beautiful thing is, EOV is working on the root. So we are getting wonderful fruit. If the root is good, fruit will be good. If the root is bad, then the fruit also will be bad. Fruit is depend on the root. So Chongmo is the vessel who is having connection with the digestion because it's working on the stomach. Who is having connection with the absorption because it's connected with the spleen. Person is telling, oh, I can't digest the food, or I am not having good hemoglobin, good vitamin B12. Stimulate the Chongmo. Right? It will improve the digestion. It will improve the absorption. Most of the absorption is happening in the small intestine. हम खाना खाते हैं, स्टमक में तो उसे गलाया जाता है. स्टमक में उसे गलाया जाता है. इस स्मॉल इंटेस्टाइन में उसे एब्जॉर्ब किया जाता है. So it's working for the small intestine absorbing the food. So it's a very good person in the hurry and curry. अब आपको मानो सुबह सुबह आप उठे, 8 बजे सो के उठे और 8:15 को 8:20 को आपको थाने से बोरीवली की ट्रेन में बैठे. अभी 8 बजे उठे हो, कितने मिनट हैं? 20 मिनट हैं. 20 मिनट में क्या क्या करोगे? बाथरूम जाओगे, ब्रश करोगे, नहाओगे, नाश्ता करोगे और भागोगे. पेट साफ होगा क्या? पेट साफ होगा 20 मिनट? नहीं होगा. So person in the hurry, curry and worry also having constipation. So Chong also working on the constipation, which is due to the always hurry, hurry and hurry. It will balance the system and it will bring the, it will normalize the stool and the urine. आपके stool और urine को normalize करने में मदद करेगा because it's supplying the lower abdomen, upper abdomen and the chest region. It's working on the pancreas. And we know pancreas is secreting LAT, lipase, amylase, trypsin, lipase for fat, amylase for carbohydrate, trypsin for protein digestion. So you will able to digest the food properly because Chongmu will balance your pancreas. Even it will help in the diabetic patient. It will work on the liver. Then you are having good type of the digestion. आपका पाचन सुधरेगा. You know, the overactivation of the adrenal gland, जब adrenal gland का overactivation होता है, adrenal gland, the hyperactive activation of the adrenal gland से क्या होगा? Adrenal gland sugar को बढ़ाता है. पता है ना, adrenal gland is increasing the level of sugar because of the secretion of steroids. Adrenal gland hyperactivity will increase the BP. So Chongmu is very, very good for high BP and very, very good for high sugar. So master point of Chongmu is spleen 4. As soon as you put the spleen 4, it calm down your BP quickly. Why? Because it's balancing the adrenal gland. हमारे adrenal gland को balance करता है Chongmu. Got it? It's working on the kidney. So you are doing normal urination. आपका पेशाब भी ठीक रहता है. Okay? So ultimately, if you remember, Chongmu is the sea of artery and veins. ये हमारी आर्टरी और वेन्स का समुद्र है. The sea of artery and veins. So if there is any blockage in the arteries, any blockage in the vein, like triple vessel disease, blockage in the coronary artery, some blockage anywhere in the artery like Raynaud's disease, blockage of the artery in the legs, there is a disease, Raynaud's disease, varicose veins, or any problem which is having connection with the artery, vein, anywhere in the body, capillary, artery, vein. We have to work on Chongmu. Chongmu is the sea of artery and vein. Chongmu is the sea of blood. अब किसी का ब्लड ठीक नहीं बन रहा, हीमोग्लोबिन डेफिशिएंट है, हीमोग्लोबिन कम है, we will work on the Chongmu. हम Chongmu पर काम करेंगे. Chongmu is very good for dysmenorrhea, menorrhagia, hypermenorrhea, oligomenorrhea, पीरियड का कम आना, ज्यादा आना, दर्द के साथ आना, कष्ट के साथ आना, बंद हो जाना. These all things we will be working on Chongmu. हम Chongmu पे वर्क करेंगे. The person is suffering with the chest pain, cardiac pain, heart pain, angina pain. We will work on the Chongmu Person is having no hunger, we will work on the Chong Mo. Person is having bloating in the abdomen, we will work on the Chong. एक बार आपको रूट समझ में आ जाए तो सारी बातें क्लियर हो जाती हैं, राइट? इतना क्लियर है सभी को? तो आई विल एक्सपेक्ट फ्रॉम ऑल ऑफ यू before the next class we start, you should remember roots of the Chongmo. बाकी सब चीजें अपने आप आ जाएंगी. But remember this thing, the master point of the Chongmo is spleen 4. Couple point will be pericardium 6. इसका मास्टर पॉइंट क्या है? स्प्लीन 4 है. कपल पॉइंट पेरिकार्डियम 6 है. और कंसेप्ट वही रहेगा जो हम हमेशा समझते आए हैं. टोन द मास्टर पॉइंट एंड सेडेट द कपल पॉइंट. मेल फीमेल का आप जानते हैं, राइट? जनरली व्हेन वी आर मेकिंग प्रोटोकॉल फॉर मेल एंड फीमेल, so spleen 4 turn on the left side, pericardium sedate on the right side. For the female, spleen 4 turn on the right side, pericardium 6 sedate on the left side. If we talk about the female, uterus is very important organ. CB1 we are using bilateral, both sides. And for the male, we are using stomach 30 bilateral, both sides, and we are completing the protocol. So if the person is suffering with any type of the problem, we can add this point. We can add few more points. We can add urinary bladder 11 and the stomach 37 or stomach 38 with any protocol. Why? The UB11 is the upper SU point and the stomach 37 and 38 are lower SU point of Chong. यानी UB11 हमारी चोंगमो का अपर SU पॉइंट है और ये दोनों नीचे लोअर SU पॉइंट है. इसका मतलब है कि वहां से एक ब्रांच यहां पर भी जाती है. तो UB11 आप लगाएंगे और स्टमक 37 38 भी लगा सकते हैं नीचे की ओर. तो अगर आपके पास कोई भी पेशेंट आता है, आप ये सारे पॉइंट्स लगाकर देखिए और फिर देखिए क्या होता है. So UV11 is the upper SU point for male female both. Stomach 38 and 37 are the lower SU point for male female both. Stomach 38 and 37 are very, very effective points and they are working for the digestion. We do even method. इन सारे पॉइंट्स पर हम even method करते हैं. ओके, डन. चलिए अब हम मिलेंगे अगली क्लास में. कल हमारी पैरालिसिस वाली क्लास होगी 7 बजे से. कल कल चौंगो खत्म कर देते हैं 9 बजे से. 9 सवा 9 से क्लास लेंगे, है ना? चौंगो इज वेरी सिंपल, हमें इसी के कनेक्शन समझना है. चौंगो इज ऑलरेडी डन. तो कल हम क्या करते हैं? टुमारो विल डू 7 o'clock TCM for stroke and paralysis. 9 o'clock we'll do in the evening only EOB. so that we can complete the Chong. Okay. From the next week, we will revise entire EOB. Revise means we will take the quiz. हम आप सबकी क्विज लेंगे, हम एक एक करके सारी वेसल्स के ऊपर फ्रॉम द नेक्स्ट वीक ऑनवर्ड्स. अभी से थोड़ा थोड़ा प्रिपेयर करना चालू कर दीजिए. ओके. So now let's close the session. See you tomorrow 7 p.m. and the 9 p.m. in the night. Good night.